With the onset of the COVID-19 pandemic in 2020, the world turned its focus to reducing the spread and mitigating the impacts of the pandemic. But this is not the first time a pandemic devastated the world, and it certainly will not be the last. Between 2011 and 2018, there were 1,483 epidemics in 172 countries, with diseases including Ebola, cholera, Zika virus, measles, polio, and more, costing thousands of lives and millions of dollars. Although the most obvious effects of an epidemic are on health, epidemics can have a much broader impact on society. Take, for example, the many lockdowns due to COVID-19 pandemic that had a major impact on the economy, movement, and on society. During an epidemic or pandemic, health systems may be unable to respond to other health crises and routine healthcare needs such as immunization if workers are overwhelmed or ill. The time to prepare for future epidemics and pandemics is now. In this video, we will learn more about epidemics and see what Red Cross and Red Crescent national societies can do to manage this type of risk. To start with, what are epidemics? An epidemic occurs when more people than usual have the same communicable disease in a particular location. More people become infected than in normal situations, exceeding the community's ability to cope. Epidemics are important because they represent the point at which a disease goes from being a threat to individual well-being to community well-being. Epidemics usually spread within a country, whereas a pandemic is an epidemic that has spread over multiple countries or continents, usually affecting a large number of people. Let us see a few examples. In 2019, the Philippines experienced measles epidemics that spread to different parts of the country, while the COVID-19 disease reached almost every corner of the world in a few months. But how do epidemics occur? Let us have a closer look at the factors that are key for the occurrence of diseases. A disease occurs when an agent, such as a virus, bacteria, or parasite, infects a susceptible person or a host. Groups that are often more susceptible to infections include unvaccinated individuals, pregnant women, the elderly, children under 5, and malnourished individuals, depending on the disease. Large numbers of these groups influence how susceptible a community may be to an epidemic. Other environmental factors, such as seasonal changes, water and sanitation conditions, proximity to wild animals, and presence of vectors, such as mosquitoes, can also impact both human and animals' vulnerability to infectious disease. It is important to note that 70% of new infectious diseases that have emerged in humans over recent decades have come from animals. Diseases that are transmissible from animals to humans are called zoonosis. This includes, for instance, dengue, Ebola, and SARS. Most zoonotic diseases are a result of increased contact between humans and animals, usually due to deforestation, urbanization, and climate change, which enables for infectious agents to jump from animals to humans. Early detection of an emerging disease often relies on close surveillance of human, animal, and environmental health. This is what we call the One Health approach. Let's now see, what can we do to prevent and respond to epidemics? In fact, there are many things that communities, national societies, and society at large can do. Communities are the first to notice when an unusual health event is occurring. Equipped with information and skills, they can play a key role to prevent and control the spread of diseases. Community-based health and first aid, as well as water, sanitation, and hygiene programs, help strengthen community resilience. Epidemic prevention and control activities are effective ways to mitigate risk. When appropriate, establishing a community-based surveillance system to complement and feed into existing disease surveillance systems can support early detection and control of epidemics. And investing in risk communication and community engagement allows for two-way communication between communities and disease surveillance systems, and is a key to prepare for and respond to epidemics. For national societies, some actions to build capacity can include training of community-based volunteers and national response teams in epidemic prevention and control measures, preparing critical health and care services managed by national societies for epidemics, including, for example, health facilities, blood banks, and pre-hospital care facilities, and strengthening the overall operational capacity of national societies to manage health emergencies. Within society at large, we know that epidemics can touch virtually every facet of our lives, including food production, trade, transportation, and education. When services and employment are disrupted, day-to-day life is turned upside down. To build resilience of societies, some actions which can be taken include promoting a whole-of-society approach to epidemic risk management, supporting the development of country-level policies, strategies, and legislation for the management of public health emergencies, or strengthening collaboration between disaster management and public health authorities. As we have seen in this video, epidemics and pandemics pose a serious threat to the health and well-being of millions around the world, but there are actions we can take to be better prepared. To learn more about epidemics and what your national society can do to prepare and respond, please visit ifrc.org.